We begin with breaking news about the coronavirus.
The deadly coronavirus.
More than 200 cases.
2,000 new cases.
More than 17,000 people.
Biggest quarantine in history right now taking place in China.
Don't panic about it. It's coming to a neighborhood near you.
The world has operated on a cycle of panic and neglect.
The press is overreacting, and it makes me furious.
This is their new hoax.
The risk to the American public of contracting the coronavirus remains low.
Fascinating to see a sporting event take place in front of an empty stadium.
Upcoming games are also going to be played to empty stands.
What we do with not shaking the hand is setting a sign.
If I show up to an arena and ain't no fans in there, I ain't playing.
NBA is suspending the season.
Rudy Gobert has tested positive for the coronavirus.
Breaking news just keeps coming today. Donovan Mitchell has tested positive for coronavirus. The ACC, the Big 12, SEC, Big 10, and AAC all announced that they would be canceling their conference tournaments.
Mark Emmert has just announced that the men's and women's tournaments, along with all winter sports, have been canceled.
These obviously aren't normal circumstances.
We have never seen a day like this in sports, perhaps in history.
And honestly, it may just be getting started. Coronavirus has impacted millions of people around the world. As of Friday, the World Health Organization claimed that over 175,000 people have been infected, 5,000 people have died, and these infections have spread across 131 countries. I was booked on the NCAA tournament, I was booked on NBA TV, and I was booked on Champions League all in 1 week. And it was all supposed to start Monday. However, in a matter of hours, I went from getting my schedule to hearing that the Final Four is fanless, to hearing that the NBA is on hiatus because Rudy Gobert has coronavirus. And once the NBA put the entire season on hiatus, one by one, everything just started getting canceled. The next day, I went into work and just watched SportsCenter. And it went from being a 30-minute SportsCenter leading into the ACC tournament to a 12-hour SportsCenter with breaking news just about every 15 minutes until 5 o'clock. To be honest with you all, coronavirus has been very confusing to me because when the NCAA tournaments were announced that they were canceled, along with winter and spring sports, the Europa League was still going on. Earlier in the week, the Champions League still went on. Liverpool played in front of all their fans at Anfield, and even though they lost, they still played in front of a packed house. While PSG played in front of an empty stadium against Borussia Dortmund, and even though they qualified to the quarterfinals, all their fans lit the streets red. The U.S. women's national team won the She Believes Cup in front of a sold-out crowd. So again, I don't understand how severe coronavirus is if these events are still going on. Second thing that was confusing about coronavirus is that the symptoms are very similar to the flu, and you can contract pneumonia. Now, pneumonia can be treated. The flu has treatment in Theraflu, and there's also a vaccine. So to me, when I initially heard about coronavirus, I didn't understand why it was taking so many lives and why so many people were infected when it's very similar to things that aren't new to us already. The final thing that made this really complicated for me was I don't remember the sports world or the world itself shutting down as a result of any other virus that has come about within the past 20 years. All of this has been very confusing to me, and I know I'm not the only one out there that is wondering how severe coronavirus really is. So I decided to reach out to a world-renowned infectious disease doctor to get his thoughts on coronavirus and best practices in combating this virus. Dr. Joseph C. Gathe Jr. is a world-renowned infectious disease specialist located in Houston, Texas. He's had a private practice for over 30 years near one of the most advanced medical centers in the world. He has been at the forefront of treatment for things such as HIV and AIDS and for hepatitis C. So as you can about imagine, a lot of his patients have pre-existing conditions that make them even more susceptible to coronavirus. He's been following it very closely, so I figured that I should ask him to come on my show. Dr. Gathe is also my uncle. I turned to him for a lot of medical advice, and I figured that I should go to him again concerning coronavirus. Check out this interview that we did in light of this pandemic. We're joined by Joseph C. Gathe Jr., known to me as Uncle Joe. Uncle Joe, thank you so much for being on the phone with us.
Chloe, thank you for the invitation. It's my privilege.
So my first question with coronavirus is, why is this so different from other viruses that we've seen in the past, like the common cold, SARS, etc.?
think the first thing for everyone to realize is that the family of coronaviruses have been around for 800 years, and they primarily live in animals, and they hang around there and don't cause any problems, but occasionally a strain of viruses will become active enough to affect humans. And it's happened a few times in our history already. Your listeners may have heard about SARS or the MERS outbreaks that we had in other parts of the world. And that happened, but the good news is that those sort of burned out very quickly on their own. The difference in between with this one is this particular strain had the ability of not only infecting people, but being highly contagious to people, such that it spread very, very quickly before people really realized it. And so while the virus has been around for a long time, this particular strain is very unique in its ability to infect people and to be spread, before people can even sometimes get sick. So that's what this one was so unique about. And I think the other thing for the audience to realize is that what's different now is compared to maybe years before, people travel very, very much. And so once someone got infected, you can have that person travel somewhere in the next few hours and be in an entirely different environment and spread it, not realizing that they have been infected. So a lot of different things happen to make this particular one very different than what we've ever seen before. So
you talked about how the coronavirus is spreading so quickly, and from what I've also heard just from other news outlets, there's a high infection rate but a low mortality rate. Why, in addition to there being no vaccine, is this a cause to worry?
So what we know is it's highly contagious. The good news is the percentage of people that are dying from the disease, the numbers are not very great. The problem, though, is that we think about 1% of people that get infected may get very sick and potentially die. While 1% doesn't sound like a very big number, if you have a lot of people infected, that ends up being a fairly high number. And so while we say it's not a lot of people getting sick, we think that the mortality rate from this particular virus, simply because of the numbers of people that are infected, will be 15 to 20 times higher than the flu that we're seeing at this point in time. And that's what our concern is. And because we don't know exactly who's infected in our communities right now, we don't know how exactly to make sure the people that are at risk for not just getting an infection but getting very sick from it, we don't know how to tell people exactly who to stay away from at this point in time. And that's one of the major problems that we're facing at this point in time.
How worried should we be?
Well, I think the biggest problem that we have is that we're not prepared. We've known from the infectious disease community that an epidemic such as this was going to happen, but we didn't know when it was going to happen. And so we have not had a strategy or a framework to build on for when an epidemic like this happened. And in fact, we've done the exact opposite. Over the past few years, we have closed hospitals, we've closed ICUs. We've done this because we're trying to be, quote unquote, cost effective in medicine by, keeping people out of the hospital. Therefore, hospitals are, closing down, and beds have been gotten rid of. And because of that, the infrastructure of medicine is not able to absorb the surge of a disease process like this, even though we knew that eventually this could happen. And so I think a lot of the concern/hysteria is that we are not built to be able to handle what may come, and we don't know what's going to come. And unfortunately, the leaders that you hear have not given us an organized game plan on how to handle this. It's like going to a basketball game and you're a team, but you have no idea what the playbook needs to be, and the coach that's leading your team is not giving guidance to the team on how exactly to handle it. So I think from the practical standpoint as an infectious disease person, one should be concerned about the presence of the disease in our communities. One should do what it takes to put themselves in a position not to get exposed, as much so for the individual person as it is to make sure that you don't spread it to someone else in our community. And that's unfortunately what we're seeing right now. You've seen in the nursing home where one person came in and infected the entire nursing home, even though that one person may not have been sick. And so the concern we have is that we need to do what we need to do to protect ourselves. They're calling it social distancing. But unfortunately, our leaders have not given us a strategy on how best to do it. You see certain communities doing some things, certain communities doing other things. Now, some people are closing down schools. Some people aren't closing down schools. Some people are saying no gatherings more than 1,000 people. Some people are saying no gatherings more than 200 people. And so all of these things, unfortunately, are, I want to say made up, but they're made up. And that's back to our leaders not giving us a structure on how to handle it. I think the concern would be a lot if everyone had a united front in our communities about how we're going to approach this in our individual communities. And that's what I think we need to be focusing on to get that factual information.
I think the confusion, I echo that sentiment with confusion. Just from a sports standpoint, you have, just in this past week, while the NCAA tournament was being announced that it was canceled, the Europa League was still going on, and some of those games had fans. The Europa League round of 16, the Rangers-Leverkusen game had fans, whereas the game with LASK and Man United did not. So from a sports standpoint, it was confusing to us to figure out, like, you know, what is the proper mandate. So I echo that sentiment on it being complicated.
Yeah, it's a concern. It's like telling your kids to do something, but you don't do it. For example, just look at the daily news conferences that we have. We're telling people to social distance, but at the news conference, you have 10 to 20 people on a podium standing right next to each other, shaking hands, hugging, sharing microphones, while we're telling everybody else not to do that. So it makes no sense, and that's why our communities are confused about what to do. And it's frustrating to me as a doctor because I'm trying to tell my community and my patients the best I can tell about what to do, and then they turn on the TV and nobody's doing it. And that, you know, that's a big problem and a concern.
So you were saying that with the infectious disease community, you guys had figured that there was an epidemic that was going to be at this level for quite some time. The World Health Organization for the past couple months has echoed that there has been a cycle of panic and neglect with every new virus that breaks out. That, you know, societies will panic when the virus is here, but then when the virus no longer affects the entire world or an entire community, then we neglect to put in best practices to make sure that nothing like this ever happens again. Do you think that that's the reason why coronavirus has affected so many people? And do you think that breaking out of that cycle of panic and neglect will lead to a cease in viruses like this from coming up again?
There's absolutely no question about that. There has not been an organized approach by any of the leaders in our community about how to handle this. The World Health Organization, again, knew this was coming, but again, there's been no guidelines or infrastructure about what to do when it starts. How do you handle travel? How do you do, what are the best practices in the societies about what to do? Now, saying that is a difficult task for the World Health Organization because they are tasked with having to deal with the whole world, different populations, different cultures, and things like this. But again, there has to be some kind of structured organization about telling people what the best practices are based on, what we think this particular virus may do or whatever the infection may do and what it will do in the societies at this point in time. And then it's up to the countries to adapt that. But again, we didn't, the World Health Organization wasn't helpful, I don't think, with us. And even if they were, we sort of have a standoffish attitude in the United States where it hasn't happened here, so we're not going to worry too much about it. When it started happening in China, I don't think most people didn't spend a whole bunch of time thinking about it until I saw the first cases, and I said, well, that virus is on an airplane right now. It's going all over the world, and what are we going to do about it at this point in time? And I think this has to be a wake-up call for the World Health Organization and all structures of organized public health in every country to have an organized approach about how to handle this the next time that it comes around, because it will come around, and it could even be worse the next time we're coming through. And so I hope it's a wake-up call that we don't try to do this in an after the fact happenstance way, but to be a proactive, know exactly who's going to do what, and when these things happen again.
Following coronavirus for the few months that I have personally, it reminds me a lot of other viruses that have happened in the past. In Texas with West Nile virus, with or even, being able to intern with you in the summers, learning more about HIV and AIDS and how that spread started. And it came from SIV, which is a simian immunodeficiency virus, which was from a chimpanzee and spread human-to-human contact. Does this coronavirus remind you of any other pandemic that you've dealt with in the past?
It absolutely reminds me of the HIV epidemic in the past, because we performed as poorly there as we're doing now. When this first started, when the HIV first started, we labeled it a disease of certain people, IV drug abusers and Haitians, and eventually gay folks. And if you weren't any of these people, there wasn't anything to worry about. And our public health officials essentially said, don't worry about it. This is going to burn out. We're going to have a cure in a year or two. So just don't spend a whole lot of time worried about this. And it took actually several years for us seeing patients to tell the public health services that this is actually not the case. And there was a lot of years that it took before we actually were able to get a handle on trying to get the education out to the communities, to get the testing that we need to do to try to figure out who was infected, and to do what it took to put people in a safe way to not get infected. And so it reminds me a lot about HIV. It wasn't quite spread as rapidly as coronavirus, but the whole lack of infrastructure and how we responded to it is very, very similar. And so our ability to handle pandemics, we have been woefully poor at, and we unfortunately didn't learn the lessons we needed to from that, and now we're suffering those consequences now.
Do you think it's going to take a few years before proper testing is given out to this many people, or there's like an adequate grapple on coronavirus?
So I think we're going to get the testing is available. The question is getting the testing out in bulk. Again, our medical infrastructure is not made at this point in time to, in an organized fashion, get things out to the masses. We have been sort of pigeonholed with medicine, where people with insurance get this, and you can't get that unless you go to your doctor, and you can't get this unless you go through co-pays. And so that's the way the structure is at this point in time. For example, somebody gave me a kit now. If you didn't have insurance, I wouldn't know how to get the test done for you. We're now getting overrides, but we're doing this after the fact. All of that stuff should have done the first time that this started happening, before we even had the disease that we saw on our shore. Just say, hey, this is coming. We're going to get the test out in the next week or two. It will be free of charge. You charge the government, 1-800-GOVERNMENT, for the cost of the test. We're going to give it to the leading people in the country that deal with infectious disease processes, and let them in their communities figure out how to get them out to the people. So they're going to get out, but it's going to be happenstance with this. For example, if you are an undocumented alien in Houston, where are you going to go get a test done? Nobody's told anybody that. They're afraid to come out. If you get the test done and you're positive, you don't have any insurance, where are you going to go get your health care? If you're homeless and you're positive, how are you going to self-quarantine? See what I'm saying? And so all of that stuff hasn't been told to anyone, and all of that stuff should be now being told to everyone about how we're going to handle that, and that's a problem. And so Part of it's getting the test out, and they're coming, albeit slow, but it opens up a whole nother can of worms about what you do with the reports. The other thing is, you may be exposed and the test is negative. You may need to get the test again. And then once you're exposed, you have to get the test twice to make sure it goes away before you can go back in the public. And so some people may need to have 3 or 4 tests done, and we don't have the infrastructure to do that either yet. So it's frustrating for us out here in the field where we're the tip of the spear, where we're dealing with what we know needs to happen, and we don't have the backup, if you will, to get things done that needs to be done.
What can you take from past pandemics and apply to coronavirus, even in spite of not necessarily having all the resources and all the knowledge to fight this virus?
So what I think we need to take is that we need to have almost like a siren going off that X disease process is coming to our shores, and we're getting ready to fight it, and here's what we're going to do. Here are the people in the communities that are going to be equipped to handle it. Here are the things we're going to give them to handle it. We're going to subjugate the whole issue of access, if you will. We're going to make sure that people get access no matter what, no questions asked. We're going to allow the pharmaceutical companies to have promising drugs to be able to use those drugs early on without necessarily having all of the FDA approvals. And we're going to do this in an organized fashion because we now have the people designated in each community that are going to be ready to fight this. It's just like if you have a fire, you're going to call the firefighters and they know exactly what to do. If you have an epidemic affecting these processes, you're going to call the people in the communities that deal with this and have them do what needs to be done and give them the tools that need to be given to them so they can handle it. And that's the only way we're going to stave off the next epidemic that comes. And I hope, for God's sake, that we learn from the atrocities of what we haven't done with this, that we're not going to repeat it when the next one comes, because the next one, I promise you, will come. Hopefully never, hopefully not soon, but we have to prepare like it may be coming in the next 6 months.
Now, it's interesting. The other day, you sent me something where there have been tests in Germany about Listerine being able to fight coronavirus. Can you tell us a little bit more about that?
So when we face things like this, we all get, in our little chat rooms and internet things and pass on little pearls that we think may be of benefit. And one of my colleagues realized that the virus dies with Listerine, and if we know that the virus can grow in the throat and begin in that particular area, if you actually get exposed in that area, if you can kill the virus before it sets up shop, it may be a good way to help prevent not only just that other person from not getting sick, but also not spreading the virus to someone else. Let's say you got exposed and you're not very sick, but it's in your throat and it's growing, but you got to go out to the grocery store. It would be great if we could get the bug content down out of your throat so that you don't have much less of a chance to spread things around. And that's back what I'm saying about getting people that are on the forefront to say, what little pearls can we do to help out and get that information out very quickly. That little pearl came in one of our chat rooms that we were talking about with my colleagues and say, hey, this works. And somebody else said, yeah, I tried that. That worked too. Very simple, not expensive, and something that may help save somebody's life, to be quite frank. So those little things are very, very important once the infrastructure of people that deal with these problems are able to communicate and have the things that they need to push forward.
That's really good to know. There have been a lot of references in terms of flattening the curve. Can you explain what curve that is?
So, as I said, the United States is not ready for a surge of a lot of people coming into the hospital. I've been told in the United States we have about 100,000 ICU beds and less ventilators at this point in time. So, if everybody in the United States gets sick all of a sudden, there's no way that we're going to be able to accommodate that surge of people in the hospitals. And so one of the goals is to flatten out that curve. Namely, instead of getting everybody sick in the next 2 weeks, if we can spread it out so people don't get sick except over the next 2 or 3 months, then we're able to clear those rooms and have enough structure in the hospitals to be able to take care of folks. But they all surge and get sick all of a sudden. And I show you Italy, where they got sick all of a sudden and overwhelmed the system. That's not what we want to have. So flattening the curve is decreasing the numbers of people that are getting sick in a very short period of time and try to spread that out over time. Whether we can do that or not, we don't know, because we haven't gotten the test to know how many people are even potentially sick at this point in time. And that, out of everything that's happened to date, that is the one thing that has slowed us down the most. If we had those kits over the past 6 to 8 weeks and we could test people, then we'll know this community has a lot, this community doesn't. There's a big pocket of it in this zip code or whatever else, and we can have a better idea of how to flatten that curve, because we'll know who's on the curve to start off with.
So what are other infectious disease doctors and medical journals saying about this? Do they think that it is going to act similarly to the flu, where it flares up during the wintertime and then kind of goes dormant during the summer?
You know, that's a good question. I am praying every day that this is going to be a seasonal disease and it's going to slow down as the weather gets warmer. We frankly just don't know. As I'm thinking about that and saying that, all of a sudden, Tom Hanks and his wife get infected, and you know where they are?
Australia.
And you're Australia. You know what's happening in Australia? It's summer. So, as I'm sitting here saying that, it's summer in Australia, and Tom Hanks, I guess, theoretically got infected down there. I don't know what the caseload is down there in the warmer climates compared to the cooler climates that we're having here now. But I'm hoping, God willing, that it's going to peak and die down. If we can believe what they're saying in China, they think they're saying the numbers die down now. They've had so many people already infected anyway, it may be dying down just because everybody who was going to get infected gets infected. But I'm hoping that as the weather gets warmer, we're going to see a downturn of the cases. But we have no idea of this virus because nobody's ever seen this virus before, this type of coronavirus infection before.
We're seeing price gouging across the nation. Masks are being hoarded by lots of people, and that's taking away from the hospitals that need it the most. We're seeing that toilet paper is no longer available, the disinfecting wipes, paper towels, and even things like bread and chicken. Do you think that people should prep for this like a hurricane evacuation?
So let me say that price gouging should be illegal, and those people that are charging, $200 for a mask should go to jail, period, the end. That shouldn't happen at that point in time. That's the first thing. The second thing is, in order for us to fix the epidemic, we can't fix it without good citizenship, doing the right thing. If we tell you to social distance, but you're running around anyway, we're not going to fix the epidemic. If you're going to go buy every piece of Purell in somebody's store, and then the poor grandma and grandpa down the street can't get any, then that's not right either. And so some of this has to be good citizenship of the society, recognizing the problem, taking what you need, but don't take more than you need, and what you take or have, share it with your neighbors. If the neighbor next door can't get out because they're elderly, bring them the toilet paper and the other stuff that you bought at the store at this point in time. But there's no reason, I don't think, to hoard 2, 3, 4 weeks worth of anything at this point in time, because I think, as bad as it might get, I think the basics of society will probably continue to function. Now, I'm looking again at Italy at this point in time. I mean, the worst it's going to get is if it gets to be like Italy. Now, in Italy, they've shut everything down, but the supermarkets and the pharmacies are still working. And as best I can tell, everyone is getting what they need as far as food, basic clothing, basic services that they need at this point in time. I hope it never gets that way. But going and buying everything in the stores and not allowing the rest of your neighbors to get it is just not good citizenship. And we can't fix the epidemic without having everyone in our communities pulling together and doing what they need to do to make sure that their community remains safe.
Do you think things are going to get worse before they get better?
I think it's going to get worse before it gets better. The question is, how worse is it going to get as far as what percentage of people are going to get sick versus elsewhere. What I don't understand in the epidemic is why Italy got hit so hard as far as not just the number of cases, but the percentage of people that have gotten sick compared to other countries where it has not seemed to be like that. I haven't seen those same numbers in the UK or Ireland or whatever. And so again, it's a vast unknown, and we just don't understand what really happened in Italy, because they have a very good healthcare system, but they got overwhelmed very quickly. And I think the fear, if you want, for want of a better word, is that we could become Italy versus becoming some other country that is not hit hard. And I can't answer that, and I don't think any of our respected colleagues know the answer to that at this point in time. So when you see that, you plan for the worst, but you hope for the best. And the way to plan for the worst, to try not to put yourself in a position to spread the virus anywhere else. The visitation not to nursing homes, I think shutting down the gatherings like for sporting events and things like that. I think all those things are very, very appropriate to make sure the social distance is there, because we have to not be Italy. If we become Italy, then we're going to have a huge problem, because we do not have the capacity to do the surge. And it's not just the beds. Think about this. If a nurse gets infected in the hospital, a lot of nurses aren't going to be able to work. It's not going to have any beds. You're not going to have any personnel to take care of any of these people. They're going to be at home with their families, or they're sick and this kind of thing. And so it's a huge potential of a problem if it really gets to be like it is in Italy at this point in time.
Organization en masse to practice good citizenship and to plan for the worst, but also hope for the best. Dr. Gathe, I appreciate you for coming on, taking out time in your schedule.
And let me add one other thing. There's a lot of hysteria. There's a lot of, I guess the right word is misinformation. If you have to listen to anyone that's going to say anything, the person that knows the most, and is the smartest person I know with this, is Dr. Anthony Fauci. I've known him for 30 years. He's helped us get through the HIV epidemic. I feel that sometimes what he has to say is sometimes overwritten, if you will, by other people on the podium. But listen attentively to everything that he says. He has our best interest at heart, and he's a brilliant virologist, and he knows how to help us navigate. And so when the TV goes on and his face is on there, my eyes are glued to everything he says. So if you got to listen to anybody, Google him, listen to him. He's going to tell you the right things.
Sounds like a plan. Thank you so much, Dr. Gathe. I'll definitely drop links down below for all my listeners if you guys want to learn more about coronavirus and listen to some top experts talk about this situation.
Happy to do it, Chloe. Let's do it again as more information comes by. Happy to be a part of your team.
Awesome. Sounds good. Thanks so much.
All right.
For more on coronavirus and infectious disease medicine, please visit the links below. Stay safe, everyone.